Hello everyone. So in this video we are going to study about macrocephaly. So macrocephaly is defined as an occipitofrontal circumference of more than 2 standard deviation for that specific age and sex. The causes of macrocephaly can be understood easily by understanding that there can be major three things that can lead to macrocephaly. Either the bone, that is skull bone itself, is increasing in size, that is leading to increase in the size of the skull bone, or either the brain parenchyma is increasing in size, that is leading to enlarged skull. Okay, or either there is increase in CSF, that is leading to macrocephaly. So we'll start with an abnormal growth of skull bone. So abnormal growth of skull bone can either be due to a bone disease or there can be bone marrow expansion. Bone diseases can include osteogenesis imperfecta, also osteopetrosis, and other bone diseases. The bone marrow expansion, the main disease to be remembered is thalassemia, where we see extramedullary hematopoiesis that leads to bone marrow expansion in the skull bone. Talking about the bone parenchyma causes, these causes include, the main cause is the megalencephaly. Okay, in this case, megalencephaly, we see an enlarged brain parenchyma that in itself leads to enlargement of the brain and then the skull, that leads to macrocephaly. Now, megalencephaly can be familial. In the familial case, we mind you that in the familial megalencephaly, the babies has a normal size, okay, and there is no neuronal deficit, and overall development is normal. Only there is megalencephaly leading to macrocephaly. Also, megalencephaly can occur because of neurocutaneous syndrome like neurofibromatosis. It is also seen in lysosomal storage disorders. Okay, one more reason can be a metabolic disorder. We also need to know that if megalencephaly is occurring because of a metabolic disorder, the baby will have a normal head circumference at birth, and later on when he grows, he develops macrocephaly. Okay, now the third and last cause, an important cause we are going to study, is increase in CSF. Now increase in CSF is what is known as hydrocephalus. Okay, and in a patient of hydrocephalus, a patient with hydrocephalus postnatally develops a rapid increase in size of the skull, presenting as macrocephaly. Plus, he will develop symptoms of increased ICT that include nausea, vomiting, irritability. Okay, these signs will also be present in a baby born with hydrocephalus. Another cause for increase in CSF can be a benign enlargement of subarachnoid space. These patients are normally develop the increased amount of CSF for around 6 months, and then the development slows down. Okay, the indication for evaluation in a case of macrocephaly is when the occipitofrontal circumference is more than 3 standard deviation, or the head circumference increase is more than 2 centimeter per month for the first 6 months of life. We also need to know that cases of familial megalencephaly and increased subarachnoid spaces need no treatment and resolve on themselves. But cases like hydrocephalus need to be treated. Either we can make ventriculoperitoneal shunt or can go for other procedures for decreasing the CSF amount. So these were some things we needed to know about macrocephaly. Thanks for watching.